Hi, guys. This is nursing home abuse lawyer Will Eadie at Eadie Hill Trial Lawyers. I am coming out to talk a little more on this Healthy in a Nursing Home series to give you 5 tips to help prevent bed sores in a nursing home. And I should say up front, not a nurse, not a doctor, a lot of respect for the medical profession, a lot of respect for nurses and doctors. And so obviously you have to go with the medical professionals that are working with you. But if you are a family member of somebody in a nursing home setting and you're worried about bed sores, what are the things a nursing home abuse lawyer who deals with bed sore cases would recommend you do to help make sure that your loved one avoids pressure sores? So number one, the number one thing about bed sores, and the reason they call them pressure sores, is help relieve pressure. So what does that mean? Well, when your skin is compressed, say you're sitting down or something, the skin's compressed and it's compressed up against whatever bony surfaces are underneath. Some places you have a lot of fat and not a lot of bony prominences, and some places like your hips and areas like that, you have bony prominences. Those are target areas that if pressure is there too long, blood doesn't get to the tissue death or destruction can result. And then that from that inside out comes this bed sore that forms. So helping to relieve pressure by making sure your loved one is turned and repositioned frequently, that they're getting up in a chair, up in a walker, moving around in bed, whatever is within their ability, with or without assistance, depending on their ability, should be encouraged. And you can also help make sure the staff are doing what they're supposed to do with regard to turning and repositioning. So if you can ask what are the orders about that. If it's every 2 hours and you're there for 3 and no one's coming around to do that, you can point that out. Or if you leave mom in a certain position and you come back later and no one's helped her move around, you need to be bringing that up. So number 2, in how to help prevent bed sores as a loved one, as opposed to a nurse or a caregiver, is to schedule visits over different times of the day. And the reason I say that is it's easy to get into a routine. Okay, every night for dinner, or twice a week, or once a week, and kind of get in a cycle of a certain time of day. And a few things happen when you do that. At nursing homes that are understaffed chronically, the staff will start recognizing when you're coming, and they'll either provide some cleanup care before you get there, or they'll assume you're always going to do it at those times, and they won't do things during those times. So there's a lot of ways that they'll try to take advantage of your coming on a regular schedule to lighten their load. Now, look, I don't blame nurses or aides when they do that if what they're doing is trying to be sure that everyone gets enough care and they know they don't have enough time. It's because the parent company, the nursing home company itself, or usually a parent corporate owner, particularly for for-profit companies, is understaffing. So they're triaging. And if they know every day Jim's going to get help with dinner and they can then spend that time doing something else, I don't blame them for wanting to make that trade-off or needing to make that trade-off. What I blame them for is being put in that situation to begin with. So schedule your visits to, if you can, come at different times, or if there are other people who can visit. So if you have a child or brother or sister who can't make it in every day, can't make it in every week, but could stop by periodically and mix it up and check on certain things for you and let you know, that can be really helpful for figuring out there's a problem brewing before it happens. Number 3, help them eat and drink. Okay, so this is so important for your health, the health of someone's skin, particularly as we get older. It's really critical that we eat enough nutritious food, get enough protein and everything. And number 2, that we have enough fluids, or our skin will not be as healthy, won't recover as well from injuries, will be more prone to pressure ulcers, and will be harder to heal. In fact, one of the things nutritionists do when someone has a bed sore is increase the protein that they get, increase these nutrients that they get, really to help the body be able to heal, the skin be able to heal. And so you want to make sure they're getting that. So what does that mean? That can mean if someone needs assistance eating or drinking, that you make sure they're getting that assistance. Maybe you help out, try to help out when you're there, but obviously it's critical that when you're not there, that the facility is doing their job. If you see that food plates are being left and they're not giving assistance, that it's cold, things like that, that's a big red flag. The sooner you can address that, the better. And then assist them with drinking fluids in particular. Being dehydrated can be devastating and lead to urinary tract infections because of lack of voiding and buildup of problems there. It can lead to kidney failure, skin breakdown, shock, making you more susceptible to shock. Just goes on and on. So number 3, keep them eating and drinking. Number 4, and this can be a delicate one, okay? This is your parent, this is a loved one. Make sure that you insist on being present when they're changing your loved one, whether that's perinatal care, changing undergarments, soiled undergarments, toileting them, what have you, or changing their clothes. Now, one thing I hear, and look, I'm sure there's a lot of great nursing homes that may do this as well, but when I deal with a nursing home, it's because something went really wrong. So what I hear from my clients is, I never knew there was a bed sore. I never knew there was a red spot. I never knew there was a problem, because whenever they'd change mom, they'd say, you need to step out of the room. You need to step out of the room. Now, if you are in Ohio, they would call it a sponsor. If you're a power of attorney for medical purposes, if you have your loved one's permission, you can insist on being present and viewing skin. And that can be really critical because the area around undergarments can become wet from voiding, obviously. And if they're not changed frequently enough, that extra moisture, or if they're left in a wet sheets too long, that moisture can lead to skin breakdowns. Can lead to infections. If fecal matter is allowed to stay on too long, or get certain places, that can lead to infecting bed sores that already exist. So you want to be able to insist, I want to see what's going on. And the other thing to know about that is if there's a smell. Why doesn't they smell clean? The clothes are washed. They've just been cleaned. I still smell something. Don't brush that off. Foul odor can be coming from an infected or sometimes even a non-infected wound. So if you have any sense of some weird smell, you need to inspect, assuming you have the rights and everything, you need to inspect, you need to ask to be there and see what's going on. Because all too often I hear from people who say, I never knew there was a bed sore until she was at the hospital. And by then, it's way too late to get aggressive about things. Number 5, report issues immediately. Food not being fed well or served well, or lack of eating, lack of voiding, smell, skin redness and irritation, pain, anything. You need to report it. You need to report it to nursing, director of nursing, and I always prefer put something in writing to director of nursing administrator. It could be an email, whatever. Make it clear. And number 6 is a bonus. I know I said 5 tips. Bonus item here, document. Never trust that a nursing home is photographing wounds, measuring wounds, recording things you tell them in the records, writing them down accurately. You just can't trust that. So what do? I always suggest get a diary. Get a separate little, carry around diary or calendar if you like writing in calendars, whatever, notepad, what day, what time you were there, who was there, what you observed, what you said, who you reported it to. Try to get names of staff members, even if it's just the first name. Staff members in nursing homes in Ohio are legally required to identify themselves. You're legally entitled to know who the people are caring for your loved one. So there you have it, my 5 plus bonus 6 tips for helping a nursing home prevent bed sores of a loved one. So I hope that this series helps. And if you have questions, the website, I'm sure, is in the comment area or the description area, and you can always reach out to us. Even if we can't take the case, we're always happy to help.